Thank you guys for coming to our final webinar of the fall season. This has been such a great 6-week series. For the past 5 weeks, we've had some really, really wonderful topics. I think a lot of you guys have been involved, which has been so great. We've really loved having everyone participate, and we love that you guys come back for more. But if you're new to it, some of the ones that you might have missed, we started off with GLP-1s Q&A. Then with the other two dietitians that we have here at Well by Messer. Then we talked with Dr. Andrew Moad about advanced screening tests. That was really cool. So some of these tests that you might not think about when you go for your annual physical, really cool, innovative cancer screening tests and other things like that. Then we talked about off the radar endocrinology treatments with Dr. M. That was really fun. Some of the different medications and different treatments that she uses that aren't necessarily what everyone kind of thinks about with sort of outside of it, the regular endocrinology tools. Then we talked about 4 key questions for your primary care doctor with Dr. Shabra. That was really great. It's just a great refresher to think about different things that maybe you might forget before you go into your annual physical, things that you might want to review with your doctor. And we always like to say, when you're meeting with a Well by Messer doctor, it's concierge care without the concierge fee, right? So you are meeting with Dr. Shabra for a very long time. It's not that quick 15-minute, try and cram it all in kind of annual physical. She's really there to deep dive and make sure that everything's, all of your questions are answered. So I thought that was a really great topic. I really enjoyed that with her. Then we talked last week, it was me and Barry, another one of our dietitians again, and we talked about supplements, which was really fun. And now this week, we have a wonderful guest with us today. We have Dr. Ina Lazar. We are talking about innovative eye health. We are talking about technology, longevity, nutrition, and menopause. And Dr. Ina Lazar and we had like a really great conversation this summer. And I was like, I didn't know that menopause and eye health had really anything to do with each other. So we had a great conversation. And then I just wanted to bring her here to introduce her to our Well by Messer audience so that she could share a lot of her wisdom with us. So thank you so much for coming.
Oh, no, thank you for inviting me. It's always such an honor to talk to someone who as passionate as I am about menopause and overall health and eye health. So thank you.
Absolutely. We're so happy to have you here. So, what I'd love to do is just have you introduce yourself, give us a little bit of your background, and your specialties. And you have a practice here in Old Greenwich, and you have another location as well in Connecticut. But we'd just love to hear about how you started, what brought you to this field, and your expertise.
Sure. So I am an optometrist. I have degree in doctor in optometry, meaning I do not perform surgery. I do the comprehensive eye care and I do specialize in ocular surface disease, which I realized after practicing for a little bit after graduation, so many women are suffering from dry eye in particular, and there was no treatments available. So for me, that was a no-brainer why I wanted to go on my own and start the practice. And since 2015, I've been practicing. In 2017, I started my first practice, dry eye practice in Old Greenwich. And then during COVID, everyone being on screens, that just exacerbated so much. We had to expand to Darien office and multiply our treatment lanes and multiply our treatment devices to address this pandemic of ocular surface dry eye in women and men, which we will talk as well about men. They deserve care too. And I've been practicing since dry eye, lots of dry eye.
Amazing. And she is so well regarded around here. So, for anyone joining the chat, I'm Catherine Staffieri, and I'm working here in the Well by Messer Greenwich office. And Dr. Lazar has so many like loyal followers. When I posted this on Instagram, I got like 5 different DMs like, I love her so much. She's so great. So you really have sort of brought a lot of wonderful awareness, right, to eye health. And you've made people aware of things that, potentially they weren't necessarily going to take care of, or even were maybe sort of related. So I just love that you're bringing a longevity and like a really interesting approach to eye health.
Absolutely, because the more we learn about eyes, we realize it's not just the eyeball, it's everything. It's your systemic health, it's your skin health, it's your face that all play a role into healthy vision and healthy comfort and just looking better. We all want to look better. That's when the whole plastic surgery got out of control during COVID because we're all on screens, we see ourselves. And I realized treating dry eye and treating ocular surface disease has so many positive impacts on the rest of the body, how the patient feels, how the patient looks. And that's very important.
Absolutely, absolutely. And then I also just want to let everyone know, as usual with our webinars, please feel free to pop questions in the chat as we get going, and or unmute yourself and feel free to just interrupt and say, can we go back and talk about something, go back and address something that we had previously been talking about. So really casual conversation. But let's dive into it. The new frontier, innovations transforming eye care. So really, some of the research that I was doing before this was that there's so many interesting new sort of screening tools, treatment tools, really like AI powered diagnostics that can detect eye disease like diabetic retinopathy and macular degeneration much earlier, allowing for more timely interventions. Smart wearables I thought were really interesting, like contact lenses and devices for managing conditions like glaucoma and dry eye by like continuously monitoring eye health. And if anyone's been listening to this, basically the every single webinar, I find a way to tie it back to continuous glucose monitors. um, and it's the same way, right? So I always said it's so interesting to, it's like kind of interesting to take your glucose test, on like one day, but that only tells us how you're doing on one day, right? Probably similar to going to the eye doctor, maybe like at one time. But if you can get something that's continuously monitoring your eye health, perhaps you can get a broader picture of what's going on, which I think is really cool.
No, absolutely. And we learn more, and AI I think, is becoming such an important tool in diagnosing and even creating these algorithms to help managing patients. And I love that you said about glucose monitor, because patients that suffer from glaucoma, which is elevated eye pressure, what we know now is the eye pressure changes throughout the day, and it's independent of your systemic blood pressure. So patients usually wake up with the highest pressure in the morning, and then it goes down throughout the day. So we bring these patients back multiple times throughout the day to check their pressure. But now we have these devices that patients can take home and do their own pressure checks, and we get the notification. So it's a good time to be practicing eye care, I have to say, because just 10 years ago, we had nothing. We were just very dinosaurian ways of treating patients and diagnosing. And now we have so many tools. And I love technology. So I always try to bring in the newest stuff to my practice so I can offer this. But this is very, very exciting. About the AI powered diagnostics, for years, since I started practicing, we are able to see and scan the nerves and pick up patients that possibly have MS, just looking at their nerves. And I think it's very rewarding if we can catch these things even before the patient is symptomatic.
And that's really it also speaks to, sort of the synergy of like you working, having the referral with the primary care doctor or with, even an endocrinologist, someone that, could be even pre-diabetic. And then their endocrinologist says, I want to make sure that you're getting regular eye checks because, and we'll go into that later, in terms of how that your eye health can really be a window into your metabolic health, which is so cool.
It is. And you know what? There's so many patients that came in to see me just because they needed new glasses. And by looking at the retina and the blood vessels through digital technology, just using pictures, you could tell the patient has diabetes. So you send them to see a primary or endocrinologist, and the patient is so happy because we're able to address their issue they didn't know they had until it's too late.
Right. Right. So another thing is gene therapies. I'm not sure if that's something that I just did a little bit of interesting. It just seems really interesting. And novel drug delivery systems are offering hope for previously untreatable age-related eye disease. So is that like advanced macular degeneration? Is that kind of
Geographic atrophy. So this is something that is very, very new. We're still learning about it. The treatments are becoming more available. But yeah, that's the future. Regenerative medicine, gene therapies, and utilizing AI to diagnose and treat patients. We're currently, what's something that we're viewing to bring to our practice is those patients with macular degeneration is actually the disease that the retina doesn't receive enough nutrients. So it starts to break down and patients lose central vision. So they can see the periphery, they can see something is going on here, but straight ahead, they're unable to read the letters, they're unable to see people's faces. We're utilizing the infrared light and low level lights to stimulate the retina and bring the nutrients, and patients show improvement in their vision. So if you see these red light masks and it feels like a gimmick, it actually has a lot of potential and we just need to learn more about it.
that is so interesting because I think, the macular degeneration is something that a lot of people worry about, as they age. And so it's definitely something that people are like, gosh, I certainly hope it doesn't happen to me, or maybe my aunt or my grandmother had it. And, I want to make sure I don't have that too, or I want to try and prevent it.
Right, absolutely. And we have ways to diagnose it and do things to help patients. The good news, the biggest trigger for macular degeneration is, believe it or not, smoking. That's why we saw a lot of macular degeneration in older population because smoking was so prevalent. We don't see smokers anymore as much. So we also don't anticipate to have as much of this disease in the future, but it's genetic disease, so we do anticipate it just in a lesser amount.
Got it. Got it. So that's so interesting.
Yeah.
All right. Well, and sort of leading into that, let's sort of talk about eye health as a window to longevity. So that's something that I like. I think, sort of studying longevity, learning about it. There's a lot of misinformation out there, right, about longevity. And I think there's a lot of like social media and stuff like that. So I love it that you really practice evidence-based medicine when it comes to eye health and longevity. And as a dietitian, I really only ever learned, eye health through diabetes, right? It was, diabetes as it gets advanced, you have neuropathy, retinopathy, and people get like blurry vision and stuff like that. So that was really my only way of kind of tying those things together. But I would love for you to talk about, how you approach eye health and longevity.
So for us, and that's been my biggest mission since starting my practice, is to be preventative rather than reactive. And I educate my patients. I take a lot of time discussing patients' health, patients' history, and educating them why we should do certain things for them so they have healthy eyes, healthy vision, and a lot of comfort, because as we age, the glands, everything just starts to dry out. And that's a huge part when that 54-year-old female comes in and says, I cannot live my life anymore. I am dependent on my moisture drops and I'm miserable. My eyes are always red. So for me, preventing this from happening, that's really my goal. So I love seeing a patient before this happens and starting them on HRT, which I work with your team. Which since introducing this summer, I work with your team. I work with other HRT specialists, and I send them. That's my number one priority, sending them to make sure there is nothing from the hormone replacement therapy that needs to be addressed before we do our job. But yeah, through eyes, it is truly window to your health. We can diagnose over 240 diseases, systemic diseases, just examining the eyeballs. It's fascinating. It's actually fascinating
Yeah.
and very
Well, and
rewarding.
what I learned about it was like the tiny blood vessels, in the retina, they reflect the health of your broader cardiovascular system, right? So narrowing in the retina or like little microbleeds can signal hypertension or diabetes or just systemic inflammation. Those are all linked to a shorter lifespan. And then like neurodegeneration can show up on the eyes first. Like I didn't really know that either. Like it's neural tissue, so that can even be maybe, is it a marker like for Alzheimer's or I'm not sure if that's true or not.
It's
Yeah.
some of the tests when scanning the retina, we're able to see possibly. It's very early stages, but
Yeah.
still it's so promising. But yeah, just what you said, retina is the only organ where we can see the eyeball, uh, veins and arteries without cutting the patient open. And it's such a beautiful, clean view. Yes, you can see the dilation, you can see the curvature of the arteries in patients with elevated blood pressures. It's really, really rewarding to see that. And when you show this to the patient, they're like, oh my gosh, I didn't know this is what my eye looks like on the inside. But yeah, we can really diagnose a lot of things looking at veins and arteries in the
That
retina.
That's so interesting. And when it comes to longevity, people talk so much about like oxidative stress and, mitochondrial decline and all of these kind of hallmarks of aging. So I think it's really interesting that sometimes you can see that decline, maybe not in ways that you would think, but like maybe in cataracts or glaucoma, that we see in, later in life. And those are things, I mean, cataracts, I know you can have surgery, right? And correct it. And I'm guessing it doesn't come back after that. But is that kind of linked to your overall health as well?
So when we look at mitochondrial activity, it is actually something that I treat aggressively in my practice for those patients that have uh, dry eye.
Mm,
Because we have about 75 oil glands in our lids that are responsible for lubricating the surface of the eye, but also retaining tears, preventing them from evaporating. And those patients that show minimal gland expression, minimal gland oil volume, we know that mitochondria is not doing its job. So we actually use light-based therapies to stimulate cell turnover and specifically the mitochondria. And over time, we see significant, well, number one, the oil production, which is very important, but also the um, regeneration with the light therapy of these glands that have disappeared over time because of poor function.
that is so interesting. So, I'm meaning again, like the red light, like I'd love to just know the mechanism of action. Is it something that you put over your eyes and it
So
pulses
we
light?
use different kinds. The one that I use specifically is intense pulse light. It is more, I don't want to say it's aggressive, but it's intense light. It's that pulsating light that dermatologists love using for their like a photofacial, for example. If you go for a photofacial, this is what they use. They use IPL. We studied IPL, why these patients that get photofacials start to improve in their dry eye. And we realized it's the impact that the light sends to the mitochondria inside the glands to start producing the tears.
That is so
Yeah,
interesting.
and they even named this process, it's called photobiomodulation. We're improving the function of the gland.
And how many times does a patient need to have the light therapy to see improvements?
So based on literature, four treatments, 4 weeks apart is a good starting point. And then we just maintain it every, 3 to 6 months, depending on patients' needs and how severe they are. But there's so many other skin conditions and systemic issues that impact and slow us down. So, for example, patients with skin rosacea, with that inflammatory skin issues, will have ocular rosacea. So a lot of times patients come in and say, listen, my eyes are red, they're watery, I am miserable. And I tell them, well, you have dry eye. And then we go into this paradox. Patient is like, no, I'm watering, my eyeballs leak. And I say, no, because it's just because you have dry eye. And the issue with it, the tears are very complex. They're made out of 3 different layers. There's a mucus layer that is produced by the goblet cells on the eyeball. Then there's a second layer that is produced by the lacrimal gland that is often impacted by autoimmune diseases. And then there's the oily layer produced by these oil glands that are inside the lids. If the top layer, oily layer, is not functioning, the tears are going to leak out just like from the faucet. So we need to have this oily cushion to keep the tears on the eye. And that's impacted by rosacea and ocular rosacea.
That is so interesting. I did not know any of this. I'm learning so much.
I'm so glad.
That is so interesting. So when someone comes to you with dry eye, you'll obviously, take a look and you'll do an exam. And then one of the treatments is really this light therapy to really help with the mitochondrial function. I think that's so interesting.
If the root cause of their dry eye is the meibomian gland dysfunction, which is these tiny glands that are called meibomian glands, then yes, addressing that will improve their symptoms significantly. Because this light therapy, it also has a lot of anti-inflammatory properties,
Mm.
which, any chronic disease is an issue with inflammation. So we
Yep.
need to address the inflammation. We need to improve the function.
That's really interesting. And I think a lot of I think it's probably pretty interesting with some of the GLP-1 use and the lowering of the inflammation in people's bodies, not just their BMI, not just having their all of these things together, having their glucose more regulated, probably just the lowering of all the inflammation in the body definitely will show up in their eyes as well. Yeah.
I see more and more patients that started GLP-1, whether it's a full dose or microdosing, the impact it has on their ocular surface is incredible.
Mm.
Like the patients look and feel better, which is our goal. Um, with that being said, there is some literature coming out, and they're not aligned with one another, how the GLP-1 can cause issues for the retina. It can cause some bleeding inside the retina. So we are starting to implement baseline testing for these patients. We've had only a very, very few patients that had shown side effects to the higher doses of GLP-1. But I think that's just something we're learning over time, and we're going to improve the dosing and improve how we can educate these patients. Because a lot of the patients that are on GLP-1s, they were not aware, nor us. We were not aware either that we need to do these things.
Right.
So as this evolves, we need to stay on top of it.
Yeah, yeah. I think it's so interesting. And I mean, personally, when I go to see my annual physical, my doctor had never asked this before, but as I have been getting older, has been saying, have you gotten your, eye exam? Have you gotten? And I was like, eye exam? I was like, sure, fine. Like, it kind of blew it off. And now I'm like, it makes so much sense. This has to be a part of your tool, this has to be, a part of all of your data gathering. If you are really trying to optimize your, what is it, your biological, no, your health span, not your lifespan, right? We're trying to optimize our health span. And part of that is obviously your eye health. It's so critical.
Eye health and good vision is so important as we get older. That's why having a cataract surgery at an earlier age, don't wait when it's ripe. I still hear patients get this information from, whoever they're seeing. Oh, I'm waiting for the cataracts to get ripe. But patients and brains, they need to see clear. And there's, a lot of literature how patients that were considered to be perhaps borderline dementia patients, um, complete resolution of symptoms after getting a cataract surgery. Brains need to see well. So as we age, we need to have a good quality, exams to make sure we see to our potential.
That's so interesting, right? And I love your point of sort of getting ahead of things, right? Making sure that you're watching those trends over time, like getting regular exams, saying, okay, this is where you were, say, 2 years ago, 3 years ago, and here you are today. What is the trend going on, in your health, so that you can make sure that it's not too late? Because I totally agree, right? Our brains, we have to give it estrogen if you're a woman, right, in order for it to function really, really well. But we also need really quality, good inputs. And I think that's totally true. I also think, a lot of this can be psychosocial too, right? So if you can't see well, maybe you can't drive at night anymore, you can't see friends, maybe you don't feel comfortable or safe going outside. And it can really lower your quality of life. And so the more we can prolong that, the better.
Absolutely. And I have a lot of patients that are readers. They love to read. And I just recently had a woman in her mid 80s, and she came in, she says, I can't read anymore. And I love reading. I rely on reading. That what keeps me going during the day. And we assessed her. We did everything we could, and it was so rewarding to see her bring her Christine Hanna book at her
Oh,
follow-up because she's reading her book now. I mean, that's why we're here.
yeah, yeah. You're
That's
making such a difference in people's lives. So, our next slide here is a little bit more, some of the stuff that we talk about as dietitians, but we really talk about key nutrients and their benefits for vision health. And it's amazing how much these go hand in hand with so many other, preventative health measures that we talk about. In fact, yesterday I had a patient, and all we did was talk about omega-3s, but it was for, sort of cardiovascular health. But talking about omega-3 fatty acids, like certainly from fatty fish like salmon, are really important for not just the retinal health, but that tear production that you were just talking about. Um, and also you can get it from things like walnuts, chia seeds, ground flax seeds, and some good trusted supplements. Do you talk to your patients about omega-3s?
truthfully, that is what I talk about all day long. It is actually a building block to produce that oily substance. You need to have a good quality omega-3 fatty acids in your system to be able to produce it. And I see it in my practice. I have patients that we diagnose and they have low oil production. And as they're starting the omega-3s over time, it takes time to build up in your system, 3 to 6 months. The volume and the quality of the oil significantly improves.
I
Like
love
we
that.
actually see it, like we see it with our own eyes. We don't need any lab tests for this. It's fascinating.
Yeah, and I think that's also very motivating for people. Like I almost, I can tell a patient to take a supplement all day long, but they forget, they get lazy, they're like, I don't know, I ran out, I forgot to get the right kind. But almost like if they can see it in or feel it, like you can't really feel your LDL. You
I
can't feel your
know.
triglycerides unless it's too late. But you can't really feel that. So there's not a lot of motive. It's hard to sort of maybe motivate to remember to take your supplements. But if you are taking these omega-3 fatty acids and your eyes are feeling better and they're like less dry, like what a great sort of a more of an immediate motivator that you are feeling better by taking these supplements. I think that's awesome.
It is very important because we don't live somewhere in Sardinia where we eat fresh fish out of the water. So we do need to make a conscious choice to supplement for things that we don't consume on a regular basis. And to add about about omega-3 is there's a new study that recently came out. I also see a lot of kids because I am nearsighted and I'm very passionate about these children who are nearsighted and getting worse. So just a little bit of side note.
Mm.
And we are able now to treat these kids. So if you identify a child that's nearsighted, meaning they can see the book, but the board is blurry, we can treat them so they don't get worse. So if they start with -1, they don't get worse to -5 and -7 and so on. We can treat them. And there's a study that recently came out that omega-3 also has a very protective effect for these children. So it
Wow.
helps them not to get worse. And I thought that's great because I see a lot of dry eye now in children due to devices. They're
I'm
all on
sure.
screens. Um, and that lack of blinking, that lack of constant self-exfoliation, because every time we blink, we exfoliate our lids and we squeeze and we exercise the glands. With the screen use and a lot of studying, they don't blink enough, which causes this gland dysfunction. So I've been putting my young kids on omega-3 for years now, and it's been very impactful. But now that it also is protective against myopia, it's great to know.
I could have used that. I was a kid with -5 and I had big Coke bottle glasses and then I figured out how to put contacts in. So high school wasn't super horrible for me because I was able to at least wear contacts. And then I ended up getting eye surgery when I was in my 20s and it really was life-changing because truly without my glasses I was a mess. I couldn't find my nose on my face. So that's incredible news to hear that, there is preventative, tools and things out there that we can do so that children don't develop really poor eyesight.
Yeah, no, it's great. And we do have treatments now. So a lot of kids are being addressed so they don't become -5.
Yeah. I survived. I survived.
That's great. Yeah, but you know what? If you do that and you know what it is in the middle of the night and you're -5 going to the bathroom or just, if there's something in the house you need to move fast, God forbid not, you wouldn't want your kids to be -5. And that's usually the approach to be preventative.
Yeah. Yeah. Well, it makes a case for, again, if anyone listening is, has young children or anything like that, but sometimes it can be hard to, get kids to eat salmon, but generally you could get kids to eat maybe you could put some walnuts in there or some chia seeds or ground flax seeds or something like that for them. And same for you. And then I always like to say again, I was talking yesterday with someone about cardiovascular health and we were talking about egg yolks. And I'm like, well, there really is some really wonderful nutritional benefits to an egg yolk. And, we can discuss dietary cholesterol versus blood cholesterol. But the point being that there really is some wonderful nutrients, lutein and oh my God, zeaxanthin. The other one.
Yes, Xanthan. That was a good try. You almost got it.
I have a dry mouth instead of a dry eye. I have a dry mouth. And so these are very, very important nutrients to protect your macular cells. And then can actually filter out some of that harmful blue light, which I thought is really, really interesting. And then we've got some of our fat soluble vitamins, A and E. We've also got vitamin C and zinc. These are very powerful antioxidants, right? That's why people say take your vitamin C if you're feeling sick or your zinc. These are powerful antioxidants and that's systemic, right? These vitamins can help throughout your body. So certainly can be impacting your eye health as well to help combat some oxidative stress and support your immune function in the eye. I used to always think like when I lived in the city and was walking around around and like I was outside all the time and all the exhaust fumes and everything like that. I always felt like my eye health was worse, just because I felt like it was coming at me so much more. Maybe I'm wrong, but I feel like my eye health
No, you're not wrong.
improved out here.
No, 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 absolutely. Vitamin D is very important in gland function. So right now, what we're seeing more and more omega-3s are being combined with vitamin D. So it just comes as a package. Lutein and zeaxanthin are very important, but we typically don't prescribe it unless we see retinal changes due to poor vitamin exchange. We just really big on healthy diet. Like I discuss diet with all my patients. And with omega-3s, I actually advise and I tell my patients small fish. You want to try the sardines, anchovies in olive oil. Those are a good source of omega-3 as well if they don't want to take supplements. Some patients don't love to take supplements. So I say, fine, you eat fish.
Yeah. Yeah, as much as you can.
Eat fish. I love that even more.
Yeah.
So yes, all these are very important for healthy retinal function and eye function.
Yeah, for sure. And it really is about that balanced, nutrient-rich diet. So that's obviously something that, we always talk about here with our patients is that, all of these things, like if you're going to have it from a fish, you're going to get other benefits to it, right? There's a synergy to these things. Fat-soluble vitamins need fats in order to be better absorbed. So you want to take it with like an omega-3 fat so that it would all be absorbed. It's more bioavailable. So it's really about eating those leafy greens, having some egg yolks, things like that. Eating foods that contain these nutrients are going to make them more bioavailable for you.
Exactly. It's exactly what you said. Yeah.
Yeah. Okay, so I know, gosh, the time is flying by. If anyone has any questions or anything, certainly feel free to interrupt us. I'm just having a great time chatting, so feel free to interrupt me. But let's move on to sort of these like nutraceuticals and eye disease prevention. So nutraceuticals are bioactive compounds from plants that can help prevent and slow progression of eye diseases, like maybe an age-related macular degeneration, cataracts, or glaucoma. They really act as antioxidants, meaning, they neutralize those free radicals that can damage your ocular tissue. And I thought, it was sort of interesting. I found there was a review article that it looked like 20 different studies and found that supplementations with with the lutein and zeaxanthin, together with the omega-3s, like you were saying, they really showed significant improvement in visual function. So there really is important research going on about this stuff. We're not just trying to push supplements or anything like that on anyone or trying to get someone to, eat a bunch of different food for no good reason. So I think it's really interesting that, supplements are being, talked about in this way and just really focusing on the prevention and what we can do with a healthy lifestyle.
I absolutely agree with you. With that being said, this is not something we were taught to practice. The literature, the science was, we don't recommend, and again, this was, I don't know, let's say 5 years ago, just 5 years ago, because I remember I was creating this post on Instagram and I'm like, oh my gosh, so many people love their supplements, but there's no scientific evidence to it. Why are they taking it?
Yeah.
So it's important to know what you're taking and why you're taking it. But since then, the way we look at things is changing. We're learning more. We're advising our patients to do better and to do more. But just 5 years ago, we did not recommend lutein and zeaxanthin until the patient was stage 3 macular degeneration. Stage 3, they're like starting to bleed.
Mm.
And
Okay.
that's when we would start recommending it. Now we know better.
Yeah. Yeah.
So we do offer, even in my practice, I have a very small selection of supplements that I have. They have scientific evidence that they have been tested, third-party tested, which is very important that we offer to our patients that have some signs of changes in their retina or have genetic predisposition. And it's been great. Another thing to note, there's a lot of counterfeit stuff
Oh yeah.
we're dealing with. And it's a problem because the cost of a good supplement is significantly higher than what they can take a picture of and say, oh my gosh, I just found it on Amazon for $34. Well, that's a counterfeit.
Hmm.
So important to, really trust your provider. This is the one that you really trust because we don't even know what's in these counterfeits ones.
Oh yeah. Well, so that was my discussion last week, was part of it, was like, you might want to take this, but no one's regulating it, and we don't know if what they say is in there is truly in there in the dose, and all that. Yeah.
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 But
So
no, it's very important. But again, if they don't want to take this supplement, it's healthy diet, and then we can transition you. We now actually, it's a fun thing, a fun fact. Do you know these floaters that patients see? You probably see a floater because you're being nearsighted, like these bugs in your vision.
sure. Yeah.
Up until recently, we didn't really have a good way to address it unless you just go in and you surgically remove the floaters or you blast them with laser. Now there's a supplement that contains bromelain, which is the same bromelain from pineapples,
Yeah. Yeah.
and it breaks down the floaters.
That's so cool. I need
It's
it.
so cool. I know. So it again, it's a good day to practice medicine.
Oh, totally. It looks like we have a question.
Yes.
Stephanie, feel free to do you want me to unmute you, or yes, go ahead.
Hi, nice to meet both of you, and I really appreciate this beautiful talk. I just started wearing contact lenses, so that's something very new for me. After menopause, I completely lost like all sense of vision near and far, and I had like three pair of glasses that I was walking around with, one for reading, one for driving, and one for just like going to dinner. And I was like, I can't do this. So I'm wearing contacts, and they're actually really great. I want to address the dry eye thing because in the evening, my eyes do get dry, and my doctor said that's because of a contacts. I just want to make sure that's true. And my other question is about macular degeneration, which doesn't apply to me, but it applies to my father. The doctor also recommended a RENS as a supplement, and I want to talk about that.
Great question. So the contact lens question, it's very difficult to answer, but just to take a note of, there's different materials for contact lenses. Some contact lenses, especially the newer ones, are made with the material specifically for contact lens related dryness. So if you're not wearing that, I would consider changing it. Um, you also want to make sure your contact lenses are daily disposables. You want to make sure you are very good and diligent. You throw them away at the end of the day. You don't rewear the daily lens. And if you are wearing a monthly lens, make sure you clean them with the hydrating solutions. But I switch most of my patients, 99% wear a daily disposable just because we want it to be super thin and super hydrating. Maybe there's something underlying going on with the gland function and tear production, so look into that as well. But if you wear your contact lenses for a long, 16 plus hours, having that contact lens dryness, it's not unheard of. You can use a moisture drop to supplement. So if your eyes are starting to bother you, just use a moisture drop. But I would look into the material of the contact lens you wear to start with.
Okay. Okay,
And
great. Because
in
I
terms
do the daily. Yeah, I definitely do the daily, and they're really helpful. And at night, sometimes I can't even take them out because my eyes are so dry. I'm like, oh, I've been wearing them all day, and I'm now doing like some drops during the day, so I'm not so dry at night.
Do you know the name of the contact lens?
Um, they're I don't know. They're the only ones that weren't that I could actually take on and off out of every one. I think it's very common, the one that I have, and it's very good and it's expensive. So I don't know. Whatever it is, I'm forgetting the name, but they're
That's all
very
right.
good.
What is the color of the box? I lost you.
Stephanie, if you want, you can give us a call. We can help figure it out. I just want to make sure we get a little bit more
Yeah,
time for
yeah, yeah.
menopause and eye health.
And in terms of AREDS, the supplement that was recommended to you, yes, that's exactly what I was referring, that we're not recommending them before. We are starting to recommend them to those patients who may have, a relative or a parent with the macular degeneration as a preventative use. As long as it's not, they're pretty big and they're heavy. They're super, we call them super vitamins. So if they're too heavy on your stomach, just find an alternative that's less heavy.
Great. Thank you. And you're already getting some new patients in the chat. You've got I hope you're taking new patients, and do you have
Yes,
practice in New York
always.
City? She's opening a Greenwich practice, but I don't know that you have a New York City one yet. Yeah.
So that's the reason why we're bringing back, because my original practice is in Old Greenwich. We expanded to Darien, but we're still getting so many patients from New York City, from surrounding areas, that we're actually expanding to Greenwich, um, to be able to offer all this to our patients.
Wonderful. Awesome. Awesome. And then I want to make sure we hit the menopause and eye health. And I thought this was really cool because I did not know that estrogen and progesterone have anything to do with tear production. And now I'm like, duh, of course it does. This like totally makes sense. But do you want to give us like, yeah, I'd love to hear you talk about it.
Again, something we had no idea about until a couple of years ago. We realized, why is my driest patient that perimenopause, menopause woman, and some men. So we started looking into it, and we realized the hormones, sex hormones, are so important on tear production. In fact, our oil glands, they're so important for lubrication, as you know now, they have testosterone receptors on them. So it needs testosterone to work and create this meibum, this oil to lubricate the eye. So, and then it's after learning this, not every patient actually needs testosterone. So what do we do?
Yeah.
So having that careful balance of hormone replacement therapy, and always working with the team, like Well by Masser, to create that perfect balance. Because what we know now, we know that we don't know, which is really sad, but at least we know we have an issue that we need to identify. Patients that are on estrogen tend to get better with their dry eye symptoms, but patients that are on progesterone tend to get worse because it's a pro-inflammatory hormone. So again, constant work with a HRT specialist is vital for us. I communicate with the doctors all the time, like, hey, listen, the patient is flaring up again. Do you think we can do some testosterone? Or perhaps we can lower some progesterone. You need and every patient is so unique. There's no a formula. We're like, okay, we're going to give them, estrogen, progesterone, maybe a little bit testosterone, they're going to be great. Not at all. It's a constant change and constant juggle of what are we adjusting in
Yeah.
conjunction with all the treatments that we offer.
And what about men? If men have low testosterone, is that also like burning sensation or dry eye? Like, is it the same sort of manifestation in men as well?
So yes, but women twice as likely to have dry eye, except now we know why. A couple of
Okay.
years ago, we were not sure why. We just said, well, it's just menopause. But now we can identify this is actually drop in testosterone, because women, to begin with, have a much lower amount of testosterone. So if the little bit is drying out and it's not being produced, they're going to be more symptomatic. For men, um, they come in, and that's usually late 50s, mid 60s, when they come in and they say, oh, my eyes are just been really bothering me. I'm having all these issues. Usually I send them for, a workup. But Men also suffer from dry eye, just less. Because they have
Interesting.
more, they're banking more testosterone compared to women.
That is so interesting. Yeah. And I think, sometimes I thought the common symptoms were really interesting because I always think of it as just like, oh, dry eyes, maybe it's my allergies, but it's like eye puffiness, dark circles, maybe a burning sensation, or even do you see light sensitivity as estrogen levels fluctuate? That's so interesting.
Absolutely, all of it. And it's usually not one thing. It's my lids are puffy, my eyes are watery, I'm red. I use the Visine, which is terrible. Don't use Visine. I use whitening drops to mask it. It's a whole cascade of things that are happening. It's rarely just one thing. If it's one thing, patients usually just go over the counter and they get the moisture drop and they get by. Once it starts to pile up, I just treated a male patient yesterday, and his main complaint was fluctuation in vision, and he kept coming back because he was, very certain that it was his glasses. But if you have episodes where you see clear, that means it's your tear film that's not providing sufficient vision.
Oh, that is so interesting. I'm learning so much.
I'm so glad. I'm so glad.
So, and again, always just, imperative screening. And I know we just have a couple more minutes left. But I think really we've already kind of talked a lot about this. So, menopause related, or maybe we should just say age related, eye changes, talking about, some artificial tears, which I'm sure you can recommend reputable brand, if that's it, warm compresses, omega-3 supplements, and then really cool about the laser, sort of in office treatments that can help with it, I think is so interesting.
I love that you said UV protection because a lot of patients, and with so much misinformation on social media, a lot of patients don't realize that eyeball, it's made out of collagen, which is why when you look at an older patient, you can tell their eyeball is more sunk in
Mm.
because of breakdown of that collagen. So wearing a hat, wearing sunglasses to protect the eyeball is important. That is your anti-aging. That is your SPF. You're putting the SPF on your skin, but people forget about the eyeball protection. And that is something that women really proud of because we're able to rejuvenate, utilizing the technology that we have, we're able to rejuvenate the skin around the eye and make the patient feel and look more youthful just by treating dry eye,
That's
just by
great.
utilizing the light therapy. And we use dynamic muscle stimulation. We have, I mean, everything that's currently available, we were able to do it.
That is so, and I think, also, so that's sort of like a lifestyle thing, like getting awesome sunglasses and looking very chic wearing them. And so I think that's wonderful. But then also things like hydration, quality sleep, regular breaks from screens. What did I see in this next one? What I learned about the 20-20-20 rule. I don't know if that's something you advise your patients, but 20 minutes of screen time, look at something 20 feet away for 20 seconds. A habit that can help
This is this is just a gimmick we, I think, as eye care professionals made up. There is no science behind it.
Okay.
We needed to say something for patients to follow to at least give the eyes a break.
Got it.
Because
Yeah.
I am personally, when I'm sitting down to write something, I am glued to my screen for hours, and then my eyeballs start to like hurt. But yes, sleep is so important because a lot of as you hit that perimenopause, menopause, your sleep declines. So again, the patients come in because their eyes are starting to feel uncomfortable, they're dry, but they're also not sleeping well. And as you have a patient improve their sleep, their eye symptoms start to go away. So it's all one thing. Your eyeballs are not separate from your body, which is something that we viewed eyeballs for decades. It was like, there's you and then there's your eyes and your teeth. Your teeth and your eyes are totally different insurance.
It's true. It's totally true.
It
Different
shouldn't
insurance.
be this way. It's wrong. It's a wrong approach because it gives the patient a feeling, oh, I only go to see an eye doctor because I don't see well. If I see well, I don't need to. But there's been numerous instances when a patient came in because the spouse scheduled the husband, and the patient had, melanoma inside their eye, and they're usually not symptomatic. There are no pain receptors on the inside of the eye. There's heat receptors, but there's no pain receptors. And patient had a melanoma, ended up, we treated it, we sent him to oncology, but survival rate is not
Wow.
promising.
Wow. I didn't know that.
So,
Yeah.
yeah, so if you see well, it really means not much,
Yeah. Yeah.
unfortunately.
There's so many other things to be aware of. And I love that it's, looking into your eyeball, you can truly see your health. You can see your vascular damage. You can see kind of what's going on with that systemic inflammation, which, I think is really key.
Yeah.
So, and then obviously, maintaining your healthy weight and managing chronic conditions like diabetes and hypertension, because absolutely they can impact your vision and your eye disease risk. So, sort of one can trigger the other, right? If you know that you are, edging towards, perhaps like, in the pre-diabetic zone, edging towards perhaps a diabetic zone, it's so important to get your eye care. Make sure that you're tracking with your eye health. Same thing if you have hypertension, high blood pressure, that can absolutely impact your eyesight, and kind of, vice versa. It's all connected.
Everything's connected.
um so vision for the future, I feel like it's like a really motivational picture on there, but really super interesting to be, to find a doctor like Dr. Ina Lazar, who is really innovative and holistic in the sense of looking at the entire picture, understanding that eye health is truly systemic health, and that you have to have a partner with your endocrinologist, a partner with your physician, a partner with your gynecologist, because all of these things are so interrelated. And understanding life transitions, right? Your eye doctor should understand where you are in your life, what is going on with the rest of your body, and should ask, really helpful, questions that take into account, who you are systemically, not just right here. So I think this has just been incredibly informative. Anything else that you'd like to share with us before we're finished?
No, I'm just grateful for inviting me. I think this is an important conversation because since I started my practice, I have been knocking on doors with endocrinologists and primary care doctors in town, and like you need to send your patients for comprehensive eye exams, even if they claim they see well, for these reasons. So I'm grateful that you are raising this topic and you're bringing it to light.
Thanks.
So thank you.
Thank you so much. And then one final question: is there a practice in New York City you can recommend? I don't know if you have any colleagues in the city, or
Well, it depends on the need. Is it a dry eye patient?
I'm not sure. Maybe you can send maybe you can send me your recommendations and we can pass it along. Or if the person who asked the question wants to chime in.
I did. It's actually for dry eyes. Yes.
So there is a practice in the city, Dr. Rolando Toyos. He is somebody I trained with, and I use his approach now, and he's the person to go to if you're in a city.
And if you are a well by Messer
Thank
patient,
you.
yeah, certainly, Dr. Lazar can send me that contact information, and we'd be happy to forward that over to you as well.
Very
That would be
easy.
great. Thank you so much.
Wonderful. Well, thank you again so much for your time. We are so grateful that you were able to come and talk to us today.
Thank you. Thank you for having me. And yeah, till next time.
Wonderful. Have a great day, everyone. Thank you so much.
Thank you.
Bye.
Bye.
Thank you.